Hello, my name is Suzette Urquidez, and the title of my project is Assessment of Adult ST Elevation Myocardial Infarction STEMI Patient Treatment Times when directly transferred to the Cardiac Catheterization Laboratory versus the Emergency Department. This is the final project for Finance Nursing 593 for Professor Mary Gish. My project will be to assess the treatment times of STEMI patients who are directly transferred to the Cardiac Catheterization Laboratory versus the emergency department. This descriptive design and causal comparative study will review retrospective data to determine the patient treatment times of bypassing the emergency department and directly transferring STEMI patients to the Cardiac Catheterization Laboratory. The patient focus of my project is the adult STEMI patients who activate the emergency medical system by calling 911. These STEMI patients are assessed in the field by paramedics for chest pain, and a 12-lead EKG is performed. If the EKG displays a STEMI, it is transmitted simultaneously to the emergency department and the on-call interventional cardiologists simultaneously. At this point, the emergency room physician activates the cardiac catheterization laboratory on-call staff. The cardiac cath lab staff has 30 minutes to arrive and accept the transported STEMI patient. Frequently, STEMI patients, often stable, are directed to the emergency department for an additional EKG, where the emergency room physician assesses the patient and administers orders. This detour delays percutaneous coronary intervention access and increases the door to balloon time for the STEMI patient. Because of the adage time is muscle, delay in treating a myocardial infarction increases the likelihood and amount of tissue damage due to the localized tissue death. The American Heart Association guidelines recommend a door to balloon interval of no more than 90 minutes. Currently, fewer than half of the ST elevation myocardial infarction patients receive reperfusion with primary percutaneous transluminal coronary angioplasty within the guideline recommended time frame of 90 minutes. Project features include the study setting, which is Salinas Valley Memorial Hospital, a 250-bed acute care district hospital located in Salinas, California. As a nurse working in the cardiac cath lab for over 20 years, I look forward to the project features, which include improvement of STEMI care and treatment times, maintaining and improving on Salinas Valley Memorial Healthcare's current chest pain accreditation status, and reducing financial costs of repetitive procedures and supply use. Project participants, audiences, and other stakeholders include our STEMI patients who receive care at Salinas Valley Memorial Hospital, our emergency medical services that provide pre-hospital care. Stakeholders include the emergency department and clinical staff, the cardiac cath lab and clinical staff, and hospital administration. The project context includes strengths, weaknesses, opportunities, and threats. Strengths would include clinical and administrative support and improving clinical staff education. Weaknesses may include lack of support with emergency medical services with the institution, or incorrect interpretations of STEMI cases. Opportunities may include improved nationally reported STEMI data, or improving financial costs to the emergency department and cardiac cath lab. And threats may include failure of staff to follow established STEMI protocols and poor or limited STEMI documentation. The STEMI data collection tool that was created and put into effect on January 2013, provides information and data used for this project. Expected results include a decrease in treatment times, and expected outcomes include improving myocardial preservation in patients presenting with STEMI effects. Evaluation goal and purposes includes review of the data with recommendations, timely implementation of policy changes, and continual quality and performance reviews. Evaluation questions will be answered via data collection and analysis and time comparisons of direct transfer of STEMI patients to the cardiac catheterization laboratory, bypassing the ED. The project design will include a valid retrospective study which will be conducted on patients who were transferred directly to the cardiac catheterization laboratory or transferred first to the emergency department and then to the cardiac cath lab, who received primary percutaneous coronary intervention. The study will be conducted from January 2013 to January 2014, and the conceptual model includes the Association of Society of Perioperative Nurses Evidence-Based Practice Conceptual Model. This conceptual model guiding this research provides the best guidelines and standards in improving acute STEMI care practice. The goal is to guide nursing staff in using evidence-based data to identify problems and introduce more efficient and effective ways to resolve problems in the acute care setting. According to this model, evidence-based practice has 5 stages: exploring the problem, collecting the information, proposing change, implementing the plan, and evaluate the outcome. For methodological approach, the instrument used is the SVMHS STEMI Transfer Data Collection Tool. It is created by the author, and the date includes the data procedure and the study patient ID, with no other patient identifiers. The STEMI data includes the time of the patient activating for the emergency medical system as a STEMI transfer, the time the cardiologist and the cath lab team is activated, time that the patient arrived to the institution, when the patient was transferred to the cath lab directly from the emergency medical system, yes or no, was the patient placed in a room in the emergency room, yes or no, what time did the cath lab team arrive, what time did the cath lab physician arrive, time of STEMI patient arrival to the cath lab, time of first device activation, total door to balloon time, and patient transfer time to the floor. The data collection procedures and schedule, including to collect information regarding the emergency medical system and hospital SVMH processes, and secondary collection from January 13 to January 14 from sources including the Emergency Medical Information Systems database and patient-specific chart reviews. The timeline for this project began in December 2012 when the project was introduced to hospital administration. In January 2013, a data collection tool was created for the project to begin. In July of 2013, the project received IRB approval from Fresno State University, and data collection will plan to end on January 2014, where the complete collection and analysis of the 12 months of STEMI data will conclude. The proposed analysis process for this study includes descriptive statistics, which will be used to determine if the outcome measures will differ significantly. To test the cardiac cath lab activation, cumulative incident plots will be generated using Kaplan-Meier statistical methods. A time to event analysis will be conducted using a Cox proportional hazards model to assess the impact of outcomes. The p-value of less than 0.05 will be considered statistically significant for all tests, and all statistical analysis will be conducted with the SPSS program. Here are my references. Thank you, and happy holidays.